in your experience with patients, if that cost difference isn't directly impacting them, if it's something that seems, less obvious, like, the drug's list price is lower, but your out of pocket is the same, or it doesn't translate in any way to a lower premium cost for you. I'm wondering, is cost a factor for patients? Are the doctors putting themselves in a position trying to make the case that it's almost like, why do I want to go down that rabbit hole? It's no difference for the patient. They don't really understand it. It's too hard to explain. So, one thing where it's going to cost you, the patient, $1,000 less, it's a great story. When there's no impact on the patient, what's that incentive for the physician to go down that path, which raises that question about OCM and shared risk.
No, and that's another fair question, but we usually on the average don't know what patients' economic thresholds are. And so we will tend to have the discussion with them in the first place. And then in some situations, very rarely, you might have a patient say, well, it doesn't make a difference on my copays. I don't pay anything. I want the brand name product. But that's not the case. We're not seeing that as much anymore. They're also trying to take into account the cost of care to the system. I am seeing that more and more. Patients are more socially aware that they do have a little bit of an obligation to try to make sure that they're making the right call for society as well. And even though it makes no difference to them economically, well, then that helps their insurance company or whoever is paying the bill on the other end. It helps them make better use of their dollars. And we're starting to see that more and more with patients as we have these discussions. But if you don't have the discussions, you won't know. And that's the thing.
No, I want to get Kathy's thought on this. Kathy, because at Pontchartrain, you're obviously seeing a lot of patients come through. Is there any gestalt or sense that patients are more socially aware in regard to the cost of treatment?
Yes, I was going to echo what Dr. Diaz said. We are seeing that. We have always been early adopters of biosimilars. And, to Dr. Diaz's point, it's part of that ethical or moral idea of being able to lower the cost for for the system, for the patient, just kind of that overall picture. And we are having those conversations with patients. Biosimilars are very important at the beginning of a year when patients' deductibles reset. So during that time, it's really nice when you're having to make those decisions, as patients are, between, rent and paying for their therapy and all of those other factors. And financial toxicity is real, and it continues to grow and be more entwined in the fabric of medical care every single day. But to go back, a step or two to your larger question, we are seeing patients be more socially aware. I mean, it's hard to turn on the news prior to COVID and not see healthcare and those costs be part of that, that news. So they do understand that. And very rarely do we see a patient argue for an originator, even if it costs someone more, because at the end of the day, I think there is still an extreme healthy respect for that physician-patient relationship and the shared medical decision-making between that physician and their patient.
Great.
And the recommendation of the physician.
Great, good feedback.
The way I like to explain to a patient is that you may not actually see the direct cost sharing right now, but the way it works is that, the way a payer looks at it is that per member per month, right? So how much are they spending right now is what's going to determine what your premiums are for next year. So I think that if you're able to lower the cost now by taking on a lower option, you're probably changing your deductibles and your premiums in the future. So, and then if you look at Medicare, which is the biggest payer, right? And, unfortunately, those are the patients that get hit the hardest because they're responsible for 20% on the infusion side. So I think if you think about it, if you have a biosimilar that costs 40% lower and Medicare is spending $1 billion on that drug, you can switch. If you're switching that biosimilar, that means that you're actually saving Medicare $400 million. And that means next year, they're not going to increase the premiums and deductible for Medicare patients by 7%, which is what they did this year.
And just
So-
to kind of echo a little bit of what Bhavesh just said, the other item too is really insurance design is definitely at the point now where it is co-insurance, so very similar to what Medicare has implemented many years ago. Most private payers are now also, when it comes to anything that's a specialty drug or anything that's a high cost, beginning now to move into the co-insurance versus co-pay insurance design as well. So again, to your point, Bruce, that really does hit that patient aspect as to their total out-of-pocket costs. And so we have to work together collaboratively to get that message across so that they can definitely benefit